Chair of the board. Welcome. Delighted. Very nice to have you here.
Welcome again. Nice to see you again. Nice to see you. Binder was one of our first employees hired.
Oh, really? Yeah.
Oh.
Lou, did you do this yet? Cleaned up? Okay, well, let's go. Sure.
And we serve the working poor, those who have little or no income. We have very few children come, but that's how we run it, and it's been very successful.
Right.
With the second chair, we've been a bit more productive too.
So how does it work then if you say working poor? How would folks find out about this and how would they connect with you?
Well, local physicians, the emergency department, the health unit, the dental community, we make referrals, and we get referrals from social services.
And you know, you had ministers throughout the years that came and threw sledgehammers here and really made it happen.
Great. Well, the Elma Council, the services on the ground, right?
Absolutely, absolutely. And as I said, really the staff and the board really have made it blossom and grow with what's needed in the community.
In that room.
Okay. OTN?
So we're opening up that service so physicians can refer clients here, patients to see specialists elsewhere, so they can come here. Our own people can be seen, we can do education. And now that we have 4 sites, 4 cameras in the building, it's excellent. So it saves you traveling, say, to MAP to see a specialist.
Can they see us now?
They can. Can they? Yes, they can.
It
may or may not be on
There you go.
I joined about 2.5 years ago now.
Right.
In private practice. I would never go back to private.
Yes,
I love the community health center setting.
Well, that's great. You know, this interdisciplinary team model is something that I'd like to say is the way of the future, but it's the way of the present. And my sense is, if you talk to the young grads coming out of school, they are running as fast. How you doing?
I thought he might join us.
Still got all the fingers. Oh, yeah, good thing.
We've had that problem. People have said, men have said that. Yeah, put that in there. So what we're doing is we're going to make a vegetable soup, right, Adam? So just all the veg chopped up.
So, you guys just...
The people will come to our food cupboard on Thursday.
How am I doing?
Very surprised by the bite size.
Yeah, I think so.
And then you just take the side, and you just take your knife and
How you
you
doing?
the middle. Right like that. And then you just gotta be careful that you don't slice right through the Right to right there, yeah. And then stop. And then turn it aside, and then we get our little bite-sized pieces already.
Yeah. Look at that. Beautiful.
And then you're not gonna... And no tears. And no tears.
Wow.
Well, you did it much news.
Yeah, bigger.
Yeah, exactly.
It was a test.
I noticed it.
But no, that's
That's a neat way. You don't have to argue at it, right?
That's right. Yeah, you don't have to argue at it. And then when it goes into your soup, it still looks like bite-sized pieces. It's not chunky onions. I'm
getting close to the food.
Perfect. Yeah.
What do you think of this special?
I didn't get to taste it. Dump this in here?
Yeah. There's some roasting in there.
Adam, while you instruct the Premier, can I ask you how important is it to have the Premier come today and say thanks and attaboy?
Well, it's great. I think the fact that you were here 2 years ago and to come and check up and see what we've been up to and really reached out to a number of people. So it's nice to see the support, and I think the public can make more aware of what we offer here. Because a lot of people think you have a cooking class and you run it.
One of the pleasant surprises is how this has evolved organically. To make up new needs. Helping address diabetes or helping healthy foods. It's great. This is what community health centers are supposed to do. It's just what are the needs in the community and find ways to serve them.
It's fluid and
Exactly, exactly.
What would you like to be able to do more to community centers?
Come in for lunch.
Well, I think one of the other steps that we're going to have to take together now is how is it that we can, as a society, lead healthier lives? We know that we can spend as much money as we want at the other end when people are sitting transit. I think we also understand the reason we get more funding to keep ourselves healthy in the first place. And a great place to start is what we're eating, right? Before we get to activity and smoking, those are other issues as well. Another big one is how we eating.
You cut a mean carrot.
I cut a mean carrot without losing any part of my fingers, so I'm happy.
Mango.
Thank you. Okay.
Wayne here's from Lynn.
Hi. Nice to meet you. Nice to work with you.
Hi.
Karen, how are you?
Nice to see you again.
What else we got?
Hello, Lou. Nice to see you again.
How are you? Good to see you. Hey, you're pretty good with the kids. Nice to look actually.
Well, or is it better designed for remote?
This has just been set up for demonstration. So for demonstration, we just went from one corner of the building to the other. But it's always used from outside. So we'll connect the people down at St. Mike's Hospital, hospitals in Ottawa,
Right.
other community health centers.
Yeah.
Things in general.
I want to, first of all, I want to thank all of you for taking the time to join myself and Lou here today. And I want to begin by just expressing my great appreciation for all the wonderful work that's being done here at this Community Health Center. You may recall just how far we've come. There used to be a hospital here that the previous government had eliminated. We decided to build a community health center. In fact, we've doubled the number of community health centers around the province. I think we had about 49, now we're up to 101. Built 18 new hospitals, we have 11,000 more nurses, 2,900 more doctors, 200 new family health teams, 25 nurse practitioner clinics. So we've come a long way, but at the end of the day, those are just numbers. What people really want to know is what difference does that make to me inside my community. And at the highest level, we're pleased to report that we used to have the longest, and now we have the shortest surgical waits in the country. We also have 1.3 million more Ontarians who now have their own family doctor, and that's very important to them. But then you take a look inside one of our community health centers, like this one right here, and see the marvelous work that is being done. It's much more than just kind of a traditional approach to primary care. First thing that you'll notice is we have an interdisciplinary team. We've got doctors, we've got nurse practitioners, we've got dietitians, we've got people with a public health unit, we've got all kinds of people working together, coming together for the in the best interest of the families whose needs they are catering to. They're also evolving in a way to meet local demands. So the CHC here has decided that they need to do more to address diabetes in the community. They've decided they need to do more to address nutritional issues. They've got a great program here, I guess, through the public health folks, dealing with smoking cessation. And we've known for a long time, for example, in healthcare, that we're going to have to come to better grips with promoting health and wellness. Billions and billions of dollars every year go into treating illness that is 100% preventable. So when we talk about improving the quality of our health, we're talking about activity levels, we're talking about nutrition, and we're talking about smoking. So, and this community here is obviously all over those kinds of issues, and I congratulate you for that. I think a few more comments, then I'm going to open up to questions. I want to thank Lou, who has been a solid, relentless champion on behalf of his community and his entire riding for so many years now. And we were here, was it 2 years ago? Yeah, 2 years ago. Yeah. To see the community health center at that point in time. It was here, it was not as, its tentacles weren't as deep into the community, and I say that in a really positive way, in terms of understanding the needs and working hard to fulfill those needs. The other thing they got going here, which I'm really impressed with, is their new dentistry program. There are some folks for whom, getting getting to see a dentist in the private sector is a real challenge. And it can be, there's some affordability issues there, but they make it much more affordable and much more accessible in this community. And dentistry is a very important part of our healthcare system. So we're proud of that. So I want to thank Lou for his leadership here in this area and in so many others to improve the quality of life for folks in the community. At the end of the day, you know, my mom likes to say, you're only as happy as your least happy child. And you could extend that to, you know, families generally. Right? If your mom's not well, or there's something wrong with your spouse, or one of the kids has has been involved in an accident, or there's some kind of health issue, you know, we're very, very focused on those kinds of things. And that's why I was proud earlier today to announce something new in Ontario. We're saying that if somebody in the family is really sick, and you just can't do your work, because you can't focus on the deadline if you're focused on that broken hip or that chemotherapy or that. I met with families this morning, they had 3 kids there who had all undergone heart transplants. So that takes a lot out of you in a family, and you want to be there and you want to provide that love and care and support. So we're going to pass a new law in Ontario that says that you can have 8 weeks job protected, unpaid leave away from your workplace, so that you can be there with your family at a time of urgent demand on their part. We're also going to ask the federal government to do what they've done in the past, which on another matter, which is to provide employment insurance benefits, so that if you're away from work, you receive a modest level of income as you continue to pursue, you know, your family responsibilities. Some folks have said, well, what does this mean to employers? Well, to employers, you know, I've never met an employer who wasn't a son or a daughter or a mother or a father or a sister or a brother or an aunt or an uncle or a nephew or a niece. I mean, we're all connected to family. And they understand that from time to time, sadly, families are affected by medical emergencies and difficult circumstances. So you don't have to pay the employee who's going to be away. And if you're working for me and you say, I got to be with my mom, I can't concentrate on my work. When I say to you, go ahead, do that. Your productivity when you come back and your loyalty to me when it comes back is through the roof. So really it is a win-win-win for all of us when we demonstrate as a society that we recognize that families have certain challenges that unfold before them, and we need to respect the family's right to reach out and help each other. So I'll stop there. I guess the last thing, I'm not sure if I've done this, I want to thank all the folks who work here. We've got the public health folks here, we've got the people who work at the CHC, we've got some folks from the LIN here. But as a society, I would argue that one of our greatest responsibilities is to give expression to something noble. And that nobility is simply a desire on the part of all of us to help people in times of need. If you're sick, we want to be able to send a simple message. We're there for you. We're going to help you. We'll find a way to help you get better to the best of our collective ability. So you give expression to that. Lou and I have the privilege of serving in government. We try to give expression to the values and aspirations of Ontarians, and their families are very, very interested, obviously, in good quality health care, and that's what we're trying to help all of us achieve. Thank you.
Well, you know, the Premier is always welcome. He's a very, very busy man, so whenever he has an opportunity to come, it's really, you know, great to have him here, because I think it shows his commitment to, and it also allows me the opportunity to thank him. You know, some folks sometimes say, well, you know, things are not always right. But you know, here's a man that I got to know some maybe 9 years ago now, that I have 2 families, a family that lives in Brighton and a family under the leadership of this man at Queen's Park. And I'm really, really honored to serve because he really means what he says, and it allows me to do my job in my writing. So, Premier, thank you for being here today.
Pleasure. Thank you. Well, I think first of all it's important to acknowledge just how far we've come together. You may recall under the last government they closed 23 hospitals. We've built 18 new ones. They let go thousands of nurses. We've hired 11,000. And then I went through a long list, which I won't repeat earlier, about how many nurse practitioner clinics and the like that we have put in place. So we've built a solid foundation of progress. When I say we, I mean everybody who's devoted to public health care in Ontario. So I've got to commend all the doctors, all the nurses, all the technicians and technologists and the volunteers and the administrators, everybody who's committed to this magnificent enterprise of caring for each other. Single greatest responsibility that we can assume as a caring society. So in the not too distant future, we'll be releasing our platform. And if I've ever wanted our government to stand for anything, it would be good quality education for all our kids, good quality health care for all our families, and a strong economy that supports good jobs and gives us the wealth to support our public services. So we'll be building on those foundations. One of the things that we'll be speaking a bit more specifically to in the platform, I can tell you, is that we're going to need to find a way for us to assume together greater responsibility for our own health and well-being. And I think especially we'll have to begin with our children. They were so instrumental in lending shape to family practices, for example, when it comes to environmentalism. Kids would go home and say, Mom, we should turn off the lights, we should turn off the TV, or we should run the water as we brush our teeth, and all those kinds of things. But I think there's some great things that we can do through our schools to better support healthier living and healthier lifestyles. Yeah.
Irish. I wrote using which Frankfurt was, but it's tender and moving. It gives you a feel for Ireland.
All right, so
What's going on in Ireland?
let's go to the other one.
She likes.
Yeah, okay.
And organic, we're organic. Bought the building and we're going to be opening it up to local, year-round provider of produce that's local. 100-mile dinner, local, as fresh as possible, organic and natural. So obviously we're not going to have produce in winter, but we're going to have organic meats, organic eggs, goat milk, cheeses. Exactly. And that's what we're doing.
Thanks a lot.
We work at Combine together.
Really, eh?
We went there, we went CIT.
Wait, are you still at Plymouth Life?
No, I'm not this year, no.
What are you doing this year?
I'm working at Monaco Commercial Car here.
You know what I try to do at the end of every summer?
Hey Lou, how are you?
Good, how are you? How's the business?
My favorite man.
He's a good man. He's a good man. I'm proud to have him.
He's my anchor point. You better be proud. Because I'm going to tell you, about a year ago, we were in a real rough time. Lou came to town with, everybody you could think of. We spent the day walking up and down the main street, shopping, going for lunch. So the only other thing you could have done is have some pom-poms.
Well, that was your responsibility.
Yeah, I knocked up. Anyway, welcome to Port Hope.
Thanks, Elaine. It's good to be back. Yeah. It was good. We checked out the community health center. We just did a bit of shopping on that side. I bought a book and some tomatoes. And Lou said, you cannot leave town without going to see you. Nothing happens here without Blake knowing.
Oh, well. Maybe that's because I'm just nosy.
I was official agent here for a couple of runs.
Thanks so much for
That's good. Very proud. We're very, very proud. Good job.
Good.
I like the way the ball is.